The stimulability approach is a short term option in addressing articulation in young children 2 to 4 years old, children who have very small repertoire of consonant sounds. They will be using gestures and character cards, using a corresponding hand movement gesture along with a corresponding card. It is a short term program not to exceed 12 weeks. The goal of this program is stimulability and not acquisition of the sound.
Suitable populations for the stimulability approach are really preschool aged children ages 2 to 4 years old. Evidence supports that it's young children with non-organic speech delays that just they're not ready for traditional articulation therapy yet. But it's children who are stimulable for little to no sounds. So they're typically kids with fewer than like 5 to 6 consonants at the word level. This approach is really designed for children who just are not stimulable for many sounds. So unique features of the stimulability approach, a couple are that it focuses on helping the child imitate previously non-stimulable sounds rather than achieving quick spontaneous accuracy. It introduces all consonants in each session to promote broad sound awareness and exploration. It uses a short-term cycle, so it's about 6 to 12 weeks to build stimulability before transitioning to another approach. So it serves as a pre-treatment to prepare for more advanced phonological therapy once stimulability has been improved.
Therapy targets are selected in the stimulability approach to help a child expand their phonetic inventory rather than just improving intelligibility. This approach focuses on non-stimulable sounds, which are those the child cannot yet imitate, even with cues. Clinicians begin with a stimulability assessment to identify which sounds the child can and cannot produce. Non-stimulable sounds become the primary therapy targets, while a few stimulable sounds are included to maintain motivation and early success. Targets are chosen to vary in place, manner, and voicing to support generalization, and progress is monitored so goals can be updated as new sounds become stimulable.
Hi. 5 procedures for stimulability will consist of directly targeting the non stimulable sounds, making sure that we target focus on our joint attention as well, associate speech sounds with our hand and body motions, and encourage that we have vocal practice other than just therapy. And of course, that we ensure we have early success with our therapy and trying to meet our goals.
Hello, guys. My name is Saeed Omar, and I'm going to be demonstrating a very brief demonstration of a stimulability approach. I have my son here, Noah Omar. You want to say hello? Okay. How we're going to do this is I'm going to show Noah a display. I'm going to give him a brief description of what that display looks like, and then I'm going to do a corresponding hand motion with that. He's going to listen to me first, and then he's going to repeat the sound or the word and the action 3 times, and then we're going to move on to the next picture. We're going to do that about 6 or 7 probably times. Yeah. Okay. All right. So, are you ready to go? Okay. Here we go. Okay. So, the very first picture is a baby bear. Okay, and how we're going to do this is rock the baby and say baby bear. You try.
Baby bear.
Okay. Again. Baby bear.
Baby bear.
Okay, last one. Baby bear.
Baby bear.
Excellent. So now we're going to move on to the very next one, and it's called a speaky chick. Speaky chick. And how we're going to do this is we're going to put our hands like this and say cheeky chick. Cheeky chick. Good. Go.
Cheeky chick.
Good. And then one more.
Cheeky chick.
Good. Okay. And our next one is a coughing cow. Okay, now we're going to do this. We're going to put our hand above our throat and say coughing cow.
Coughing,
Okay, coughing cow.
coughing cow.
Good. And then coughing cow.
Coughing cow.
Good. Excellent job. Now we're going to do the dirty dog. Yeah, that's what dogs do, right? And that's how we're going to do our hand motion. Dirty dog.
Dirty dog.
Excellent. Again.
Dirty dog.
And then
Dirty dog.
good. Excellent. Moving on to the next one. And that one is a fussy fish. This is how we're going to do this one. We're going to cross our arms and say fussy fish.
Fussy fish.
Again. Fussy fish.
Fussy fish.
Good. And then one more. Fussy fish.
Fussy fish.
Good. You're doing such a good job. So proud of you. All right. So now we're going to do something called a giant giraffe. And how we do this is we're going to use our hands and look like stairs. Okay. And we're going to say giant giraffe.
Giant giraffe.
Good. Giant giraffe.
Giant giraffe.
Last one. Giant giraffe.
Giant giraffe.
Good. Okay. Keep it moving. Uh-oh. We got the goofy goat. The goofy goat. And how we're going to do this one, we're going to put our eyes to the ceiling like we're rolling our eyes. And we're going to say goofy goat. Are you ready?
Goat.
Good. Goofy goat.
Goofy goat.
Good. One more. Goofy goat.
Goofy goat.
Nice. Okay. Now we're going to do the happy hippo. And how we're going to do that is we're going to laugh and shake and say happy hippo.
Be hippo.
Okay. Happy hippo.
Be hippo.
Okay. Last one. Happy hippo.
Be hippo.
Good. Okay. Next is the lazy lion. The lazy lion. So this is how we're going to do this one. We're going to stretch our hands out and say, lazy lion.
Lazy lion.
Yep. Lazy lion.
Lazy lion.
Okay, last one. Lazy lion.
Lazy lion.
Good, excellent. Next one's called the munchy mouse. So we're going to push our lips together and rub our tummy when we say munchy mouse. So munchy mouse. Munchy mouse.
Munchy mouse.
Okay. It's okay. Last one. You ready? Munchy mouse.
Munchy mouse.
Good. Excellent. Okay. So now, moving along to something called a naughty newt. A naughty newt. And this is how we're going to do this one. We're going to shake our finger at him and say naughty newt.
Naughty newt.
Good. Naughty newt.
Naughty newt.
Okay. Last one. Naughty newt.
Naughty newt.
Good. Now we have putt, putt, pig. And this one, we have to do this like she's sliding, okay? Like skating on ice. Putt, putt, pig. Or roller skating. Not skating. Sorry, roller skating. Ready? 1, 2, 3. Putt, putt, pig.
Putt pig.
Good. Putt, putt, pig.
Putt pig.
Okay, last one. Putt, putt, pig.
Putt putt pig.
Good. Let me get that for you. You got it? Okay. All right. Here we go. Uh-oh. Who do we have here? We have the rowdy rooster. And how we're going to do this is we're going to pretend that we're on a motorcycle, okay? And say, rowdy rooster.
Rowdy rooster.
Rowdy rooster.
Rowdy rooster.
Okay, last one. Rowdy rooster.
Rowdy rooster.
Good. Uh-oh. And we got the shy sheepy. Okay. And this how we're going to do this one. We're going to clutch our hands together and push it down and act so shy and be like the shy sheepy. Go for it. Shy sheepy.
Chippy.
It's kind of a tongue tie, huh? Shy sheepy.
Shy chippy.
Good one. That was a good one. Ready? Last one. Shy sheepy. Good. Excellent. Excellent. Okay, here we go. Now we have something called the silly snake. And this is how we're going to do this. We're going to move the finger up my arm. So silly snake. Silly snake.
Silly snake.
Last one, silly snake.
Silly snake.
Good, awesome. Now we have something called hockey turkey. Okay, and how we're going to do this is we're going to raise a pretend phone receiver to our ear. So we're going to act like we're on our phone. Well, I think y'all do it like this. No? Do y'all do this as the phone? This as the phone? Okay. So, talkie turkey.
Talkie turkey.
Okay. Talkie turkey.
Talkie turkey.
Okay, last one. Talkie turkey.
Talkie turkey.
Good. And okay, here we go. Now, this is called the thinking thumb. And all we're going to do with this one, we're just going to give you like a thumbs up and say thinking thumb. You try.
Thinking thumb.
Good. Thinking thumb.
Thinking thumb.
One more. Thinking thumb.
Thinking thumb.
Perfect. Okay, this is going to be our last one. Are you ready? Okay. This one's called Viney Violet. Okay, and we're going to move our arms up in a winding vine. Like, okay? Ready? Viney Violet.
Viney violet.
Good. Viney Violet.
Viney violet.
Viney Violet.
Viney violet.
That takes care of our demonstration. Thank you very much. I hope you enjoyed it. Hopefully y'all have a nice day. Thank you very much.
The question our group proposes is, do you feel the stimulability approach would be an effective approach for 2 to 4 year olds on your caseload to learn the sounds they are currently not stimulable for, to walk out of the therapy program being stimulable for these sounds and not being bored by using the same gestures and cards over the 12-week time frame?